Let us continue our discussion on spinal cord ependymomas. We will answer an important question. What are the survival rates after you treat a spinal cord ependymoma? So what are the survival rates of spinal cord ependymoma? I'm Dr. Kalyan. I'm a neurosurgeon and spine surgeon. I work in Hyderabad in Gleneagles Global Hospital. A brief introduction. This is an example of spinal cord ependymoma. This is one of the most common tumor of the spinal cord, accounting for 40 to 60% of the tumors in adults and around 30% of spinal cord tumors in children. They are intramedullary tumors that arise from the ependymal cells which are there within the central canal of the spinal cord. So this is an example of ependymoma in the cervical region. Why should we know? What is the importance of knowing the survival rates? Understanding the survival rates for spinal cord ependymoma can provide insight into the prognosis and the outcomes associated with this condition. But make a note, survival rates are statistical estimates and individual outcomes may vary. So what are the important factors affecting survival rates? One is the tumor grade. This is the most important factor affecting the survival rate. But equally important is the surgical resectability. Third one is the size of the tumor. I have not mentioned in this slide, but size of the tumor also matters. And fourth one is the patient health and age. How does tumor grade affect the survival rate? Let's think about it. The grade of the spinal cord ependymoma is a significant factor affecting the survival rates. Grade 1 ependymomas are typically considered benign and they have a more favorable prognosis compared to grade 2 or grade 3 ependymomas. The surgical resectability. The extent of surgical resection or the complete removal of the tumor can impact survival rates. Higher rates of complete surgical resection are associated with better outcomes. Patient age and overall health can also impact survival rates, with younger and healthier patients generally having a better prognosis. Size of the tumor. The smaller the size of the tumor, it's easier to excise it completely and so a better outcome. A tumor which is spanning a larger segment of the spinal cord typically will have a worse outcome. So let us come to each grade of tumor. So what are the survival rates for a patient who has grade 1 tumor? Grade 1 ependymomas are considered benign and they have a relatively favorable prognosis. The 5-year survival rate for grade 1 spinal cord ependymoma with complete surgical resection is reported to be 80 to 90%. But other factors such as tumor location and patient-specific factors may also influence survival rates in individual cases. Grade 2 and grade 3. Grade 2 are intermediate grade tumors, while grade 3 ependymomas are considered malignant. They have the worst outcome. They are cancerous. The 5-year survival rate for grade 2 spinal cord ependymomas may range from 60 to 80% with complete surgical resection. The 5-year survival rate for grade 3 spinal cord ependymomas may range from 30 to 60% even with aggressive treatment. Again, other factors play a role. So conclusion. The spinal cord ependymomas generally have a relatively favorable outcome. Compared to other spinal cord tumors like astrocytomas, ependymomas have a relatively favorable outcome. Factors such as tumor grade, extent of surgical resection, and patient-specific factors can impact survival rates. Follow this one. Earlier diagnosis at a lower grade, a smaller size, and a prompt surgical treatment to achieve safe maximal excision. They give the best outcome and more than 80 to 90% survival rate. It's crucial to consult a qualified healthcare professional for accurate prognosis. Regular follow-up and monitoring are important for detecting any signs of recurrence or complications. As I keep on telling in each and every presentation of mine, it is very important to closely work with a qualified healthcare team for accurate prognosis, treatment, and management of spinal cord ependymoma or any other medical condition. This PowerPoint presentation provides a general overview and should not be considered as a medical advice. Thank you.